Millions of women are missing their periods, not because of pregnancy, not because of menopause, and most of them have no idea what it's silently doing to their bones, their hearts, and their brains. Today, we're going to talk about what's really happening inside the body when menstruation stops. Before we dive in, let me be clear. When I say not having periods, I'm not talking about pregnancy, menopause, or birth control. We're talking about amenorrhea, the absence of menstruation during reproductive years, when periods should be occurring. This condition affects approximately 3 to 4% of women of reproductive age. That's millions of women globally. And when left unaddressed, the consequences can be significant. Many people think menstruation is simply the body shedding the uterine lining, but it's actually the visible endpoint of a complex hormonal process. Think of it like an orchestra. Your hypothalamus is the conductor, sending signals every 60 to 90 minutes. Those signals tell the pituitary gland to cue the ovaries, which produce estrogen and progesterone. When the conductor stops, the whole symphony falls apart. And that's exactly what happens when periods disappear. It's not just one instrument out of tune, it's the entire system going silent. Let's talk about bones first. Estrogen plays a critical role in maintaining bone strength. When estrogen levels drop significantly, bone density can decline. Research shows that young women with prolonged amenorrhea, particularly athletes, can develop notably lower bone density than their peers. This is especially relevant to what's called the female athlete triad: low energy availability, menstrual dysfunction, and reduced bone density. Elite runners, gymnasts, and dancers are particularly vulnerable. The important nuance here is that while some bone loss may be difficult to fully reverse, early treatment and nutritional rehabilitation can lead to meaningful recovery, which is why early intervention matters. But bones are just the beginning. Estrogen also helps maintain healthy blood vessel function and supports favorable cholesterol profiles. Studies show that women with amenorrhea can develop markers of vascular dysfunction, including less flexible arteries and less favorable cholesterol ratios compared to women with regular cycles. These are risk markers, not guarantees of heart disease, and many of these changes are at least partially reversible with treatment and restored hormonal balance. And if that's what's happening to your heart, imagine what's going on in your brain. Estrogen receptors are present throughout the brain and influence mood, memory, and cognition. Women with amenorrhea commonly report symptoms like depression, anxiety, and difficulty concentrating, and these are well supported in the clinical literature. Some small studies have suggested structural changes in brain regions like the hippocampus, but this research is still early stage and more large-scale studies are needed before drawing firm conclusions. But the effects don't stop there. They reach somewhere far more personal. Without adequate estrogen, the vaginal lining can become thinner and more fragile, a condition called vaginal atrophy. The cervix may produce less protective mucus, and discomfort or increased infection risk can result. These changes are more pronounced in severe or prolonged cases, and many are reversible with appropriate treatment. And here's where it gets really interesting, because not all amenorrhea works the same way. Hypothalamic amenorrhea, common in athletes and women with eating disorders or chronic stress, occurs when the brain essentially pauses the reproductive system. Evolutionarily, this likely developed as a response to perceived energy scarcity. Reproduction requires significant energy, so the body prioritizes survival. Modern triggers include intensive exercise without adequate nutrition, restrictive eating, and chronic psychological stress. When the hypothalamus reduces its signaling, estrogen can drop to very low levels, contributing to bone loss, cardiovascular changes, and mood symptoms. PCOS, polycystic ovary syndrome, affects approximately 5 to 10% of women and creates a completely different hormonal picture. In PCOS, the ovaries produce excess androgens, which disrupts normal ovulation. Estrogen levels in PCOS are often normal or even elevated, but without ovulation, progesterone is absent. This unopposed estrogen causes the uterine lining to thicken without shedding, a condition called endometrial hyperplasia, which can become precancerous if left untreated. Women with PCOS also have elevated risks of insulin resistance, type 2 diabetes, hypertension, and cardiovascular disease, making it a systemic metabolic condition, not just a reproductive one. It's worth noting that not all women with PCOS experience full amenorrhea. Many have irregular periods rather than a complete absence, so a proper diagnosis from a healthcare provider is essential. Now, here's something most people never consider. Amenorrhea doesn't just affect your reproductive organs, it reaches into your immune system too. Estrogen is a powerful modulator of immune function. When it drops significantly, the balance shifts. Some immune responses become less effective, making the body more vulnerable to infections. Others become overactive, potentially increasing the risk of inflammatory responses. Women with prolonged amenorrhea often report getting sick more frequently and taking longer to recover. And while large-scale clinical studies are still ongoing, the biological mechanism behind this is well established. Estrogen and immunity are deeply intertwined, and when one is disrupted, the other feels it. Here's something that might surprise you, and it reframes everything we've talked about so far. Throughout most of human history, women menstruated far less than they do today. With earlier pregnancies, prolonged breastfeeding, and later menarche, ancestral women may have had as few as 50 to 100 cycles over a lifetime, compared to 400 or more for many modern women. Some researchers have proposed that this dramatic shift may be a contributing factor to rates of certain hormone-sensitive cancers, a legitimate scientific hypothesis, though one that remains an area of active study and debate. So is amenorrhea ever okay? Yes. Context matters enormously. Amenorrhea during pregnancy, breastfeeding, or as a result of certain medical contraceptives under physician supervision is generally considered normal and can even reduce certain cancer risks. The concern arises when amenorrhea stems from metabolic dysfunction, malnutrition, or untreated hormonal conditions. In those cases, it's a signal worth taking seriously. The American College of Obstetricians and Gynecologists now recognizes the menstrual cycle as a vital sign, comparable in importance to heart rate or blood pressure. A missing cycle during reproductive years warrants medical evaluation, not dismissal. Your menstrual cycle isn't only about reproduction. It reflects your metabolic health, nutritional status, hormonal balance, and stress levels. When it stops unexpectedly, that's important information your body is giving you, and it's worth listening to. If you or someone you know is experiencing amenorrhea, please speak with a qualified healthcare provider. Many causes are treatable, and early intervention can make a significant difference. If this video gave you a clearer picture of what's really happening in the female body, hit that subscribe button. Your support helps us bring you accurate, science-backed health content. Until next time, stay curious and stay healthy.